Hello and welcome to our Gold Learning viewers. I'm Fiona Lang Sharp, IBCLC and Director of Communications here at Gold Learning. Well, I have the pleasure here of being with Debra Betts, and she's going to be speaking at our upcoming Gold Midwifery Conference, and she's part of a very special add-on package called the Complementary Care Pack. So welcome, Debra. It's great to have you here.
Oh, thank you for inviting me. It's great to be here.
Well, it is my pleasure to be hosting this event. As I was reminding you offline, I had met you several years ago when I attended one of your classes here in, it's a local town to me in Canada, so it's great to be back and have being able to invite you here. It's just been wonderful. But let's get back to talking about you and introducing you to our listening audience today. So perhaps you could tell them a little bit about yourself and let us know where you are in the world and what you do on a day-to-day basis right now.
Okay, so I'm from New Zealand and I came from a nursing background many years ago, and I did my traveling around overseas and came across acupuncture and ended up studying acupuncture in London for 3 years. And then coming back to New Zealand really had a little 2-year-old baby and then became pregnant again and was drawn into the world really of helping women during pregnancy and postpartum with what acupuncture could offer. And really through working with the midwives here in New Zealand developed a practice that really specialised in that, and ended up writing about this and just becoming more and more involved in this sort of specialist area. So on a day-to-day basis, I'm now involved in a lot of teaching. I do a lot of this online in front of my computer, which has certain advantages and certain disadvantages in terms of a lot of sitting.
Sure.
But around about that, we have a hospital clinic here, which I'm going to talk about. And so I work and supervise at this hospital acupuncture maternity care clinic. And really, I'm just totally engaged in trying to make acupuncture, the benefits of acupuncture, more well known really for women when they're pregnant, because I think that we have a lot to offer, or this branch of medicine has a lot to offer.
That's wonderful. Well, thank you for that update. And I had a question for you about how you were introduced to acupuncture and sort of, I know you were working as a nurse in the UK. You had graduated there. Could you tell us who introduced it to you and how did you what sort of pushed you forward into that realm?
Well, so going back, I was when I was in New Zealand, so that's when I did my nursing training. I went to a talk at the hospital, which was all about, there
Oh,
was an acupuncturist and a homeopath and I think iridologist. And I actually went to the talk with someone else who wanted to go. I wasn't that interested. And when I heard about acupuncture, I just thought, wow, that just makes such sense to me for some reason, and became interested and did a little bit of reading about it. But there were no courses in New Zealand at that time. And it was when I was in the UK, I'd actually hurt my back and I was
oh,
having some treatment. And that was actually a chiropractor, but they also did acupuncture. And they had a certificate on their wall, and we had a conversation. And the next thing I know, I'm enrolling and going off to spend 3 years of my life studying acupuncture. I just found it totally fascinating and interesting to me now because I've been teaching it to students here as well over for
right.
20 plus years. I never had acupuncture before I went to study it, which is unusual now.
I
Most
was going
people
to
would have
ask
had.
you that. Yeah, very
I was
interesting.
I was quite shocked when I learnt in my training that I would have to be practiced on. I sort of had this very lofty idea that it was all about me doing acupuncture to other people. So I'm much more familiar with having it myself now, but there was just something about the theory and the application of it that just really appealed to me, and it's kept
Yeah,
me fascinated ever since.
yeah. I think I actually had a very similar experience because I had read about it and was promoting it before I actually did it myself. So, would recommend it to my mothers, and I'd say this is really great because Deborah Betts had told me, and so I would, tell them to do it. But I hadn't had any myself, and I certainly hadn't experienced it in pregnancy. But I did have a very positive. When I found a reason to go and have some, and You know, it really did change a lot of things for me in perspective. And of course, you can describe it better, especially if you're telling moms to go and get it. So, yeah, I highly recommend if you haven't had anyone that's listening right now, if you haven't had a chance to really utilize it, it's certainly worthwhile, especially if you're recommending it for sure. So that's very interesting about you, Deborah. That's so you ended up when you were in your when you were schooling,